Now, Dr. Bilski, I don't have dentures, and I hope I don't ever need dentures. But some of them, a couple of my teeth fall. Can I get away? Do I have to have dentures? Do I really need them?
So I can take that question different routes here.
That's what I do with my questions.
Right.
Just give you different routes
thanks.
to take this.
Thanks. If you're talking about one or two teeth, we usually talk about implants or bridges.
Yeah. Okay.
And then there are tiny removable bridges. When I hear the word dentures, I think full plate. All right. So maybe you had a horrible accident, lost your teeth. Maybe you were sick, lost your teeth. You didn't take care of yourself. You lost your teeth. The end result is you don't have teeth. So the question is, do I really need dentures? Well, that's a personal preference. I'm a dentist. I would suggest you should consider a denture or dental implants with bridges. But if you're stuck on the denture part due to cost and quickly being able to make them digitally, we can get them in like 2 appointments now.
Wow.
But the statement that we use in our office is dentures or false teeth are not a replacement for teeth. They are a replacement for no teeth.
Okay, that's being honest.
Yeah, so we use numbers and things, but say your teeth, you can bite at 100% force. Without teeth and dentures, depending on what you read, about 10 to 20%.
Wow.
It's not the same. It's not the same. Do many patients love their dentures? Yeah, because they don't have the tooth pain associated with the infection and what they went through prior when they're in their younger days. Maybe they're in the service and they were Vietnam and they weren't able to have dental care. It had nothing to do with them not taking care. They just couldn't get there.
Yeah.
And they lost their teeth. So what do? Well, you give them a denture. And they love them. And they don't complain. And then we have someone recently, we make dentures and it's not the same. So they actually matriculate back into talking about implants. And we have them wear their upper denture, which usually held in by their own saliva that they take out and they wash and they put in the dish with the fizzy tablet.
Yeah, right.
And the lowers, because there's such a thin lower jaw ridge and the tongue is movable, it's not easy to chew and articulate, meaning talk and bite. So those are the people that when they go to the denture based on whatever reason, costs, they just didn't want to deal with any surgery, we get them back and we put 3, 4, 5, 6 implants on the lower that they can actually either snap in or that we can retain them with little screws.
Wow. Yeah.
And the new system is electromagnetic fixation. In other words, there's these, picture the implant being my finger and I put this little metal cup and then we turn on the electromagnetic force and it changes and alters the grip of the
no kidding
of the piece that holds your teeth. And it's been used in the auto industry for many years. So when you go in, instead of having all these bolts you can't get to it, you have this piece that just snaps on. You hit it with an electromagnetic gun, it's in place. And when it's time to have it serviced, you hit it and it pops out.
Wow, that's pretty neat.
So doesn't it make sense? I don't have to unscrew anything. I don't have to worry about broken screws. It's a lot cleaner. It's a lot more cosmetic. So I know I got off topic there, but
no, that's really neat.
Back to the denture part of it.
Yeah.
Do you need dentures? The answer would be, do you want the dentures?
Yeah.
Here is what I think you're going to find difficulties with having a denture.
I think I would want dentures in some way, shape, or form, or I would like to eat. I would.
And then I would give you the example of some patients that just cannot deal with them.
Yeah.
Or they may gag them because you have to cover the roof of your mouth. So there's a lot to it.
Yeah. Well, as usual, I ask a question and I get a complete answer. Hey, in terms of going off, you guys do so many neat things there. This whole electromagnetic thing, we often refer to it as a Star Trek of dentistry.
Dentistry, for
it's
sure.
really cool. I mean, it's really neat the stuff you guys do.
So it could even be Star Wars-ish, depending on how you looked at it.
Yeah, true.
But, with all the laser stuff. The only regrets I have about the new stuff coming out is that I'm not 40 years old, that I would have another maybe 25, 30 years of it. I'm 60. I just don't see myself going 25 more years.
Well, who knows? Who knows? What, we have fun doing these videos. What, you want to give
Maybe
all this up?
Maybe I'll do the videos.
You want to give this up?
I'll just have to implement more bad dad jokes and keep it more entertaining than what it is, maybe.
What more can we say than go? There's not much more to be said after this. Then just head to bilskidental.com and you'll see some more videos like this if you can stand the laughter.
Yeah.
Give it a go.